The intrabeam device has multiple advantages over conventional external beam radiation. And I think the first is a fairly obvious one. The patient, from a time aspect, can get just a single dose intraoperatively if they're just going to go that route, or even if they're going to get the one dose intraoperatively in the 5 weeks of external beam postoperatively, so it's just supplanting or taking place of the boost, then there still is a time advantage to the patient. I think the second advantage is for patients that live a long distance away from the radiation therapist. A typical external beam radiation dose given over 6.5 weeks takes a lot of traveling time for that patient. If the radiation facility is a long ways away, it basically takes all that traveling time, and basically they get the one dose and that'll be it. Third advantage is basically the radiation dose, especially if you're going to get just the intraoperative alone, is going to be a lower radiation dose. For people that have a fear of radiation, I think basically you were trying to give them a much lower dose just to the tumor bed and no whole breast radiation, so it has that advantage.
Right now we're looking at using this at really cancers that have a good personality or a very low risk for recurrence, and then we're going to study this more in higher risk patients to see if they'll qualify, and if ultimately they don't, we can still use this to shorten the amount of whole breast radiation they have. So this is something that really can be done in every patient, and then only afterwards, when you sort out the pathology and using either clinical parameters or genetic parameters, we're starting to look at the genetics of cancers and determining how they're going to behave. And if they're going to behave well, you can just do the intraoperative radiation therapy. Or if they look a little bit more aggressive, you say, well, let's combine that with whole breast radiation or other treatments.